It's responsible for more sleepless nights than horror movies and coffee put together. When your spouse snores, the nights can last forever. But what causes snoring, and how do you know if it's serious or simply annoying? Dr. Alan Bruns is an ear, nose, and throat doctor at Essentia Health. He says snoring is the vibration of tissue due to a narrowing of the airway in the nose or throat. It becomes serious when it causes you to stop breathing for more than 10 seconds at a time, something called obstructive sleep apnea.
And that actually can occur several times per hour. And in those situations, you can actually have some life-threatening issues such as cardiac disease, pulmonary disease, because what's happening is that you don't have enough oxygen that's going to the vital organs within your body.
Brun says a good way to tell if you have sleep apnea is to look at how you feel during the day. Are you frequently tired? Do you fall asleep on car rides or during movies? And how often does your husband or wife complain about your snoring?
Something that happens every night. And also if you start to notice some gasping and sputtering with the individual, then that's probably a good time to come in to have it evaluated.
The evaluation happens in a place like this, a sleep lab, where they'll hook you up to a machine that will assess how much oxygen is in your blood and how often you stop breathing in the middle of the night. You'll be rated on a scale of no sleep apnea to severe sleep apnea.
A couple minutes to wake up or a couple of hours?
Brun says depending upon its severity, you can tackle snoring in a few ways. By sleeping on your side, putting your head up with extra pillows or a special pillow, cutting back on alcohol and caffeine, or losing weight. And there are even some over-the-counter sprays that stiffen up the airwaves to alleviate the vibrations. For more serious forms of sleep apnea, doctors will recommend you try a CPAP machine, which provides positive pressure in the airwaves when worn overnight. Other times, surgery is recommended when there's some kind of abnormality causing obstruction in the airwaves, such as deviated septums and enlarged tonsils. Dr. Brun says he's seen a marked difference in the lives of people who finally address their snoring.
They feel that fatigue is just normal. And it's not until they have relief, oftentimes from a CPAP machine, where all of a sudden they realize that, wow, I can feel a lot better than I really do.
With this medical insight, I'm Tracy Briggs.